Good afternoon, everyone. Good afternoon, everyone, and welcome to April's Board of Health meeting. It is 3 o'clock, so I believe we'll go ahead and get started. So, do we have any welcomes or introductions?
I don't, actually, yes, Crystal Swink is here. Mary Lou, would you mind introducing Crystal?
Crystal is the supervisor over the community health team, and she works with me in child fatality. So she is now the chair. Lillian was the chair previously. So she stepped in and taken the chair role, and I'm the review coordinator. So we'll have our report later on in the meeting.
Crystal has picked up a very heavy lift with this. This is one of the things that we've talked about previously, that we have some mandates from North Carolina general statutes that came with a lot of directions and $0 essentially. So we're so thankful for the work that Crystal's doing. She's doing it so well, and it falls into the work she's done at the health department. And then with her skills with the computer and all the things, it's been a really great time. So we're very appreciative and glad that she's able to join us.
It doesn't look like we have anybody kind of brand new board member, so we need to go around the room this time, but we'll catch that at another time too. Yes. Thank you. Has everybody had a chance to look at today's agenda? Any discussion on it or modifications want to make? Hearing none, then I'll need a motion to accept today's agenda. And second, I'm hearing it. All in favor? Any opposed? Thank you very much. Lily, do we have anybody registered for public comment?
Anyone registered for public comment?
I don't have a paper.
There's somebody who lives on it.
No, hello, I'm Elizabeth. I'm a resident here. I saw the meeting was online and I decided I'd like to hear what goes on at the meeting because I am passionate about wellness and helping people live a well life.
Thank you, Elizabeth. Hope you enjoy it.
Thank you.
All right. So not having any specific public comment, we'd like to welcome Elizabeth again. We'll move on to the consent agenda. This was emailed out, of course, and hopefully everyone had a chance to look at it. Any discussions about the consent agenda? All right. Need a motion to accept.
Motion to consent to the consent agenda.
And a second. All right. And all in favor? Any opposed? Then we'll move on to our section that we always like to have our commissioner who's on our board to give us any cross feedback between the Board of Commissioners and the Health Board. So, Mr. Commissioner, do you have any?
Not as specifics. No news is good news.
That's right. Thank you very much. All right. Now we'll move on to the Health Director's report.
Thank you, Dr. Ellington. Before I start my report, I was wondering if you wanted to provide an update to the board. I have received a couple of questions about the email that I sent regarding the social media post with the concerns about the Board of Health. And then if you just wanted to provide that, we can do that now or later, whichever you prefer.
We'll go ahead and do it now.
Okay.
Okay. So we did. We had a Facebook page from a local media outlet called Davidson Local. It was were you going to be able to pull it up? I think we have a chance while I'm in there. The Facebook page, Davidson Local does a whole lot of real good coverage of the area. What was in concern that did strike a chord to me was the actual original post versus what the link led to. So the original post spoke to something to the effect of, concerns about, some have expressed concerns about Davidson County Board of Health. And then it went on to say a public meeting with announcements will take place on the 14th. Once you click that post, all that the next page had was just our agenda. I halfway expected to see some more information about what was the expressed concerns, since that was the topic. And not seeing that, I wanted to extend a personal invitation to come to the meeting and to see if there was some issues that just citizens maybe were not confident enough to bring about or to us, and see if they did, so we could at least have it on our radar to think about. After talking with someone from Davidson Local, and extending that invitation, what I found out was that it was just more of a link to get people to realize that this is the meeting that you can come to, and I thought it was just a poor link that almost represented a negative context to begin with, and it really wasn't. But I still believe that, as you can see now that Liz got it up, that's exactly what it says. Some have expressed concerns about Davidson County Board of Health. That public meeting will be held on April 14th. Now, if you don't mind, let me click it, and then here's what comes up once you click, and it's literally what you could get straight off of our webpage about our Board of Health meeting. So I don't know what some of these concerns were, since no one came today specifically with these concerns in mind, whether they have two different boards mixed up. But as a chairman, I'd like to, for the minutes records as well as recording, to just say that we want to address any and every concern that the citizens would have, but we don't know that unless it's brought up to our attention. Amen. So please, this is our citizens' chance to come here, and we welcome Elizabeth who's here, and to bring these to our attention. But I just felt like this was not a great post to. It at least sheds a bad connotation of what might be going on, and so please, again, for the minute records and for the recording, we are here. We want to hear your concerns. All the citizens. We'll get a different building if we had to. If we had to have it, we'll use the commissioner's building if we need to. But anyway, that was my concern, and I believe that I could have been better tactful with my phone call, and I hope it wasn't taken poorly. The Davidson Local, so I do apologize if that was a little bit of a heated discussion when I made that call, but hopefully we can work together like we have been with Davidson Local. And again, we're an open book. Bring in information. So thank you for reminding me of that.
And thank you for sharing that. And again, I just want to remind y'all, we have no known calls, concerns, or anything like that at the health department. So it was a little confusing. Again, the headline just sort of says some have expressed concerns. I'll be honest with you, we discussed it this morning in our staff meeting, and I won't throw Randy under the bus, but I will say that Randy, like me, said, "Oh, I read this and thought, oh gosh, what am I going to read about the health department?" And then it was just our agenda. So it was a little bit confusing with the headline. I appreciate Dr. Ellington making the phone call to Davidson Local and asking them to sort of address that. But it doesn't seem that they were willing to say that it was anything that was misleading.
Right. Yeah, I do. That's the way it was kind of left, and I still will stand by that. I think it was I won't use the phrase that's used a lot, but I just think it was a misdirected title. I'll put it that way.
And also, I wanted to tell you, when we discussed it this morning, Jana went back through as our public information officer and the person who does the PR for the health department. And she pointed out that this was the first time the agenda has ever really been posted like this by them. Great. We wish they'd post all of them. We'd love for people to know more about it. Now we have someone from the community here. But again, when you post it with a headline of some have expressed concerns, and it's a brand new post that we've been having meetings, almost every other month for as long as this health department's been around. So this is the first time it's been posted like that. Again, I appreciate you reaching out. It was a new way of doing it. We're glad they're doing it this way, but that headline is just a little misleading for what's in the article. So, but we addressed it quickly, and there are no issues that are known. So we'll just keep our eyes and ears open for any known issues. All right, so back to it with the health director's report. Thank you so much, Dr. Ellington, for that update. Y'all know I usually give y'all the state of the agency and where we are. We're currently recruiting for a public health nurse one, a couple of nutritionists. We're very hopeful that we can get those folks hired in our WIC department. As it currently stands, we are relying on contract nutritionists to get us through our very heavy caseload. We have 2 care management social worker positions. The last time I checked, Crystal, I think there were 26 applications that you're going through on that. So a lot of interest in that role. And so Crystal's working through those and doing interviews for that. We have a few positions we're holding on. We're holding on a health educator right now and some sort of stair steps in the business office. Corinne and I are, now that Corinne's back and getting her feet under her from her leave, we're trying to figure out, getting these things in place. The office support supervisor will be important to be in place before we can hire the office support 3. So we allow that supervisor to hire somebody that works with them. April is Public Health Month. It is my favorite time of the year. Last night I concluded the sort of tour that we do through our different council meetings. I was in Lexington last night. Jana went to Denton last week, and then I've gone to Thomasville a few weeks ago, and the county commissioners put it on consent, so we don't typically attend that meeting. But we're able to go and public health is proclaimed, and we get to stand up and say thank you, and it's just a great time to partner with our municipal partners in the community. Some sad news, our assistant county manager is moving on at the end of April, so we will be seeking, or the county is currently seeking, a new assistant county manager. His last day is the last day of April. Well, he will be moving on to greener pastures in Greenville, South Carolina. And so that's a good move for him and his family. Accreditation is coming up soon. Y'all know we talk about accreditation quite often in this meeting as we check accreditation boxes with some of the work that we do. Jana and her team is incredibly busy. Sometimes there's that thing called Murphy's Law. My mama promises it really should have been Barfield's Law. When it's going to go wrong, it will. We seem to have that here in Davidson County in some ways. And the reason I bring this up now is they have completely revamped the way that they do accreditation. And Davidson County is one of the premier pilot counties for this new way. So we don't know, we can't call anybody and ask them how it went when they did it, and we can't rely on how we did it previously. It's the same general idea, but there's new benchmarks, there's new ways to prove that you've done what you've done. So Jana is really having to dig deep with her team to make sure that we're going to meet all these marks. Our team is also having to dig deep in finding the proof and the evidence of the work that we've done that is required to make sure that we get reaccreditation. If we are not reaccredited, we could lose funding from the state. So this is a very important thing that we do. This is also a North Carolina general statute. It is also met with very few dollars to do this work. So we like to call those unfunded mandates at times. That's really the best way to call that one. So we are hosting lunch and learning events in April for financial literacy. I did not come up with this. Jason Gibson did. And thank you, Jason. Our team has really enjoyed it. We actually meet in this room. We've had about 7 to 8 participants in each meeting. It's through the Housing Solutions or Home Solutions team of Davidson County. Crystal actually, I found out, has done this at the restaurant for her staff. That came about when they were here talking with us at the last meeting, which I was unable to attend, but I heard it went really well. Folks brought their own home budgets. They had a budget calculator sheet. They went through what they're spending and what they're bringing in. And it's just a great way for people to kind of learn a little bit more about financial literacy. One of the upcoming courses is about what to do to prepare for home ownership. And we have some staff members who are hoping to become homeowners. So this is going to be something that will be very useful for them. This comes to us with zero cost. So we host it here. The staff brings their lunch. We brought snacks for folks. And it's just a really great thing. So yeah, maybe like we'll be in here on Thursday. We'll just cover those up and they'll be available. But it's been really nice. And the folks who have been able to participate have really enjoyed it. I'd like to thank our supervisors who have worked to make sure that the folks who wanted to do it, there are coverage at their areas. So that's been a really good thing. Couple more things. We continue to await news about the care management team. Those 2 social workers we're trying to hire are on the care management team. As it stands right now, funding has been secured to remain in the public health department until the end of the calendar year. A reminder, this program will never go away because it saves so much money for these prepaid health plans. but it may not be provided through the local health department in the future. We don't know. We are as transparent as we possibly can be with staff. Crystal, in interviewing, picks up the phone and calls them and tells them before they even come in for an interview that we have funding secured until the end of the year. If you would like this role, we'd love to interview you, but we just want to let you know that we have no assurances past that point. So we're waiting, and I don't know when we'll hear more, but we do know it'll run through the end of this calendar year. Randy and Trey went to the Supervisors Association and they bragged about our drone program and what we're doing with technology in Davidson County. And they did it in a very respectful way. So much so that I had about 5 text messages from other people who were in the meeting saying, how did y'all get this done? Randy and Trey are doing a great job. I started getting pictures of Randy and Trey doing their presentation. So they really made Davidson County look good amongst environmental health supervisors. And people are now really interested in the work that we're doing with the drones here because they see the benefit through the program that they did. And I think I've already sent our policy out to a couple people who wanted to get that. So great job to Randy and Trey. As I tell everybody, environmental health weakness in one county is environmental health weakness in all counties because we are a North Carolina system. So anything that we can do to help our friends, it's great.
I was wondering, do you have a second, Randy, to tell us kind of what you use the drones for mostly?
Yeah, mainly, right now we're using them for on-site wastewater, final inspections. So when you have a system installed, someone comes out and does an inspection and a kind of a hand-built or hand-drawn as-built. And so that's you standing there with a pencil and a piece of paper, trying to do a bird's eye view, of what's there. We also GPS what's there. So, there's some data that's collected as well. But with our drones, we're sending them up and we're getting a picture of the installation. So that's the best drawing you can get. We use it in some other areas, but mainly that's the main focus currently.
Awesome.
We really do have a premier program according to the folks that were in the room. They said nobody else is doing what we're doing with this. So it's really great.
Yeah, and people literally do. Some of the other health departments literally take a pencil and are like 90 feet, 70 feet, et cetera. That's how it's done. That's what the records.
I've never seen one with dimensions. It's just a squiggly line.
So this is a nice thing to have, particularly if you've got a repair scenario at a later date that you can go right to where it's supposed to be.
Right.
Great point, Justin. Also, I would say as a homeowner who has a system herself and is thinking about planting some trees, I wish that this had been in place when we put my septic system in, because now I'm like, I think I know where the system is. I had it drawn, but if I had that bird's eye view of a picture, I would know where I could plant trees safely in my yard, and not impact the system. So this is going to be great for our homeowners that get to have this included in their septic system packets. So, and these would be online for folks to find as part of the work that we do.
We have 3 licensed pilots currently, and then next week I have 3 more staff that will be attending the training that we require.
It's really great. Really excited about that. We're
Thank
still,
you.
oh, I'm sorry, go ahead.
Thank you. Thanks.
We're still working on filling vacant positions in Wigan Business Office. We talked about that just a moment ago. Pool season's upon us. Stacy can tell us how much fun she's having with that.
I like being outside, so I don't bother. But yes, it's definitely busy season for us. So finishing our restaurant inspections along with adding pools is fun.
But this year you have more people to.
Yes, I have a full team, so we're excited. Yes.
And Jana's working on a marketing and branding toolkit that'll be coming soon. We're really excited about the way that our logo has made its way out there. So when people see it, they know it's the health department, but staff members are doing things and creating flyers and things like that. Jana's trying to have something that's really easy for folks to just pull and use so that we're maintaining consistency throughout the health department, regardless of who's doing what work. So thank you, Jana. That is my report, sir. And if there are any questions, I'm happy to take them.
Any questions for Lillian? Great. I love the drone situation. All right, and then we'll move on to old business, and this is where I get to first apologize if anyone sent me any requests for any future agenda topics on my Davidson County email. I don't always check it because I hate that iPad. but I didn't receive any, that I know of. Is that true? No one, anyone sent one? Okay. All right. So as you know, we set this up so that we could have, new agenda topics that could be added, usually the following, meeting. And I want to put out that I believe I will be working on one that I'll send to myself. But I will include everybody, on that, and see whether or not it will be worth bringing to the agenda, but not having any, that's all I have on that. We'll move on to the new business, and I think we have something from Mrs. Mary Lou.
So you got in your packet the report for child fatality with, what we do now. So last year we talked about, how things were changing as of July 1 of 2025, and we have transitioned to change. This has come on board, helping with the data management piece too, which is a big help. But what you see there is the summary of the causes of death of what we had with the reviews this past year. So we're looking at 2024. I know we're 2026, but we're always a year after the death. So you're going back, it gets a little bit confusing with the times, but that's what we pretty much see. When they did the changeover, we merged with the community child protection team. So what that means for all of these deaths that we reviewed with this team, this is no DSS involvement with these folks. So we had two teams. One team was Community Child Protection, which is CCPT led by DSS. Then you have another team, which was the CFPT, which is what we're reporting today. Next year, when I come back, you're going to see a whole different report because we've merged now as of July of 2025. And we started a new system January of this year to where we're putting into a national database of the deaths that's coming, that we're reviewing from this point forward. We will not be reviewing all deaths. The state tells us which ones are mandated and which ones aren't. So it will be driven by the state child fatality team, I think is what they are called. And then we'll go from there whether we review it and what we do. And we are combined together now with both of those teams. You still have to have the same membership, but it will be possibly DSS folks in the room with those, but there could be involvement. There may not be involvement. We still are having to do, you've probably heard previously with the premature babies. They may not be sustainable for life, but we still have to do those, sometimes looking at prenatal care and things like that. So it just depends on what the state says that we have to do. That is basically, I don't have anything that is major that we are going to be bringing to you right now. I will tell you, we'll be reporting on what we do this year. We did get a little bit of money. So we do have some things in the works for this year because we have had some house fires and things like that coming up. So we're trying to spend some money into some prevention strategies there. So that'll be as we go moving forward with this new team coming up. Last year, we did the pack and place. I think I reported that to you all last year. I still have some. So if you do have folks that don't have any other place to for their baby to sleep, then we do have a few of those. But we have worked really well with all of our police departments, sheriff's department. And when they go out to a home and see something, they do come back and pick one up and take it back. So that has been very helpful with that kind of thing. Does anybody have any questions for me related to that? Or
May I say something about this as a member of the team? I tell y'all this all the time. This is the absolute worst thing you have to do as a public health professional is to look at the deaths of children. Some of them, as Mary Lou said, what the position on our team calls like incompatible with life. Still heartbreaking for families, but we have to talk about the details of a death for a child, and it is just incredibly painful. So Crystal and Mary Lou, hats off to y'all for the leadership that you provide on that team. I also want to share, because there have been so many things in the news about the DSS department, I want to hit home on what Mary Lou's talking about. The 13 deaths that we reviewed as the child fatality team that occurred in 2024 meant that there was no DSS involvement in the last 12 months with this family. So that means if anyone had called in and said, I have concerns about my neighbor maltreating their children, if a child in that home dies, it is not reviewed by this particular team. It sounds silly to say that because literally it's the same team, but that it was divided in half. And the report that we give y'all is the half of the team that doesn't review those. So these deaths, when you see it, if you think to yourself, now I know in 2024, there was a child in Davidson County that died and it did not fall into any of these summaries of causes of death here. It's because it was not reviewed by our child fatality team and not required by the public health rule.
Right.
So
But moving
it will
forward,
change moving forward.
as of January of this year, we will be combined and we will see that. So our next reports will have some of that information, probably. Just not detailed information. It will be aggregate kinds of things that because we are doing, what can we do to prevent a future death? Not looking backwards. Now, if there's some recommendations that we feel like need to be done differently, like last year you saw probably on your report, we did see that maybe for the first responders, they need some more additional training on mandatory reporting. That went over very well. They did that. Lillian, she created, and we had a letter and we gave them the information on where they could go to get the training or bring someone in. And I think most of our first responders I think is what she said, did some additional mandatory reporting to DSS if they were in a situation that needed a report when there is a child death or doing those, unfortunately, when they're going in and recreating that scene. So.
Thank you very much. And I think you have a little more to do with our younger citizens of Davidson County with the health report card.
Yes, which is not much to report this year. This is every 2 year. This is I just wanted to keep that in the forefront of your mind that we are still looking at. Our school nurses was on last year's. That was a big, one of the, we made like I think a F in the report card in the, I think it was counselors and school nurses. I might have put something related to that, but we will see another one. I think it's February, March of next year. So I will be able to bring that to you once we have a new one released, and hopefully our grades will go up on some of that. I know the counselors in the schools have gone up. I can't promise that the school nursing ratio has gone up tremendous, if any, maybe stable, but we may see some differences.
Thank you. Any questions for Mary Lou about either subject? Thank you, Mary Lou. All right, and now, Ms. Janet.
All right.
Community health needs assessment and findings.
Yes. So, I'm going to try and be brief, but when there's data, there's a lot that can be shared. And I've tried really, really hard to keep it to a minimum. But again, that's not going to give you a full picture. So fear not, when everything's finalized, you'll get a link that will have the full report, a data workbook, visualizations, all those great things. Just a brief overview of the process. For those of you who may not be familiar, community health needs assessment is something that's mandated for us to do. We do it every 3 years in partnership with our hospital partners. So actually this cycle, we did it with a regional group, which made things a lot easier. But for Davidson County purposes, Novant Health, Atrium Health Department, we're all in the same cycle. We issued the same questions, and we try to align on what the end result is. So Here is our updated, kind of community snapshot. Our population continues to grow. You can see down in the corner where we've been over the last more than a decade, but population continues to grow. Like I said, our population has always kind of represented majority white, pretty much 50-50 male, female. But you will see that our population is aging. Birth rates are not what they used to be, and we don't live forever. So the population total is getting a little bit older as we go, and every time we look at this. I'm going to go to the next slide. So getting into some of the details of our social economic status in the county, you'll see there I've got the poverty level, and then those that are living even further below the 100%, 200% of the federal poverty level. Thankfully, those trends have kind of declined over the years, but not in the way we want to see it. We would hope that most of our residents are faring better than they are, but it's still, people are struggling, and we have a large county, which is hard to take into consideration when you're looking at food deserts and walkability and access to food, because you can't just walk down the street to a market for so many of our residents. The percentage of folks that live within a walking distance, I think they say, within a quarter of a mile to a food is minimal, not even almost worth reporting. So just something to remember when we look at these numbers. On the right, I've got your household median incomes by families. This isn't by households, this is by family compositions. And when you look at some of this data, it is defined differently. And you'll see some of that once you get the full report, it'll be a little bit better to digest. But just to point out, the married couples with children, that's significant median income compared to single females with children, and what they're looking at as far as a household income. I'm going to go to the next slide. So here's a little bit about where we're looking for graduation rate. So the graduation rate there at the top, that just is straight up. I graduated as a senior in high school, about 83%. Now our population over the age 25, about 11%, 11.5% do not have a high school diploma or GED. So it shows that, a good portion do end up getting some sort of education attainment there. Our unemployment rate has declined, but we're not seeing anything, that jumps out at you or makes us stand out from the state of North Carolina. About 11.8% of our population does not have any kind of health insurance here in Davidson County. And then you can see the breakdown there of private versus public insurance, but also keep in mind that some people are dual insured. So they may have more than one type, and so they have that extra coverage. So this kind of gives you a snapshot, of some of the things that folks said in their responses to survey questions. And again, this was only a small representation of the population, but these were the results that we directly received. We got about 1,000 responses on the survey. So a good portion said, yes, they do have a primary care physician. What we didn't ask and don't know is, do you regularly see your primary care physician? Folks who, sorry, I can't remember what order I put them in, who had dental insurance, about 80%. Do they go to the dentist regularly? We don't know that. But just things to kind of give us an idea and see where we might need to pay more attention. 34% said they were satisfied with the healthcare system in our community. Almost 60% said they were satisfied with their health insurance and it meeting their needs. Leading causes of death in Davidson County. This has not really changed, but cancer and heart disease have been right there since before I've been in this role. And I've compared us there to several other counties and the state of North Carolina with similar population demographics. who also see heart disease and cancer as their leading causes of death. Again, all of our rates are pretty close. Nothing that jumps out to say that we're doing something really unusual here with those. Overdose deaths continue to be higher than the state average here in Davidson County. While the numbers have come down tremendously, they still do stand out and point to an area of concern. Also, firearm deaths are still significant here in Davidson County. All right, so a little bit about mental health. We tried to tap into some of this information through the survey questions. Out of those that responded in Davidson County, that 59% said, yes, I needed mental health treatment and I was able to get it. Those who said they didn't receive mental health treatment, not because they couldn't get it, so I'm in the bottom box. Those are some of the reasons why they didn't receive mental health treatment, mainly cost or insurance. So that seems to be, you know, a barrier for folks getting care there. When you're looking at our respondents who said that they felt like they were supported, so maybe they don't, you know, need mental health care, they don't get mental health care, just in general, not family support or social support. Most people feel supported, but I feel like the numbers that are under anything under usually is reason to dig in and, you know, make sure that we're not isolating populations and that we have checks and balances with our community. And you can see there on the right a little bit about folks who actually report feeling lonely. Okay, so this is the big question that what we like to look at, our community says are the needs, the top needs, and then all that secondary data, we look at what the highest, you know, things come out as. But the community in our survey, as far as health challenges, they said access to care, substance use, and I can't see any of them. I don't know, everybody's head is another one. I'm sorry, y'all. Access to affordable medication were the top three for health challenges. And then as far as community issues in general, because when we think about public health as a whole, we know it's more than just getting to the doctor and things like that. It's a whole multifaceted thing. So affordable, safe housing, access to healthy food, and access to child care, affordable child care was brought up a lot in our survey. So here is where we've landed with our priorities. These will be the priorities for the next 3 years. This is also the priorities that are adopted by Novant and Atrium. So social drivers of health, and this will help us to focus on getting those more community-based things. Also, childcare is not listed up there, but things that, you know, make or break our folks. Also chronic disease. When I say chronic disease, I mean prevention, you know, getting people healthy food, exercise opportunities, making sure they're seeing their family physician every year and routine health screenings. And then behavioral health, looking at mental health care and substance use. From the public health perspective, we're looking more at prevention. Our, you know, hospital partners with Novant and Atrium, they have the resources to help more on the clinical side. It's more reactive things, but our real focus will be here on prevention. Any questions?
Hate to go back, but on the causes of death, you mentioned you brought firearms. Is that in the unintentional? Would that be in that 84%, I believe, or something like that?
Okay, not that one. This one.
84.9.
So yes,
Okay.
so that would fall into the unintentional injuries. But again, this one is the list, the top 10 is all ages. When you break it down by the age group, you get a little bit more information, and I would have to look and see to connect about the firearms.
If you look at it in our part with unintentional injuries with children and fire, that's where it goes. It goes under unintentional injuries and it's called accidents. And so if you break it out, adults and then break it to children. That's where we would fall with the firearms.
But normally the poisonings, overdoses, things like falls, firearms, they're gonna fall into that unintentional.
Thank you.
I wanted to make y'all aware of I can't remember the term right now, but the bias of this survey. We had about 1,000 responses. Now, there are 172,000-ish people that live in Davidson County. Not all of them are eligible. You know, the young children are not eligible to respond, and they are a number of about 172,000, but we had a poor response. The other thing I'd like to say is I sent this out to everybody that works at the county. And there are about 1,000 employees that work at the county. And I'm afraid that a lot of the responses for Davidson County come from Davidson County employees, which I want y'all to take that into mind when we're looking at this, because what I'm telling you is the indigent population in Davidson County is not well represented in this. When I first started in Davidson County, we went door to door to do community health need assessment surveys. I can give you a lot of reasons why we're not doing that anymore. I think y'all can think of some of the reasons we're not doing that anymore. We don't want to add to the unintentional firearm injuries by sending people to folks' doors. So that, I mean, like really, they're banging on somebody's door, like, oh, what are you doing? It's also time consuming, and we didn't have a lot of people that would do it. There's no funding for us to set up at the Walmart to be like, hey, would you do this? Here's a QR code. We'd love to give you a gift card if you would do this. But we've got to do something better. And this will be my mission before the next one. Jana and I to work on with the partners. But when we only get 1,000 responses, and I know it went to almost 1,000 Davidson County employees who were sitting at their work desk and most likely doing it. I shared it on my social media page. And so I know some of my friends did it too. And again, though the people that we need to be represented in this, I'm afraid, are not. I just don't think it's a good representation.
And when you see the full report, it does have the breakdown of the respondents. And then obviously you can compare that to what our full population is. And she's exactly right, you know, and it has been that way for a while, that it is very representative of the female population employed by Davidson County government. Now, it did make it a little bit further this time, but it's not as far as it could. And so that lean on secondary data is so important, because we've got to use that to help support what does surface or find what is collected in the primary to support the secondary. So.
Hard lift. I mean, again, I've heard horror stories from going to people's houses to get these surveys completed. And this was back in the day before we actually had a QR code and you actually gave somebody a piece of paper. And then sometimes you would go to homes and there was low literacy. And so you could spend 4 hours at one house trying to go through this. But there's a plus and minus with every way of doing things. And we do need to find a way to reach more people. But I do remember when I was looking at the survey responses, I was like, it's me. Not necessarily me, but people my age bracket, like the box that I check are the people that responded to this. And so, you know, I have health insurance. I have a good job. I have home stability. I'm not a substance user. I don't use mental health services. And so, you know, things like that, I don't feel like we're getting to the crux of really where we need to be with this. And so I'm excited that we did the regional project this year. And I'm hopeful that in the hot wash at the end of this, these kind of conversations will occur regionally and we can get some ideas from others on what they're doing. But I did want to share with y'all what I'm calling the survey bias with this on how it was distributed in the 1,000 responses we got. Just acknowledge that that is what we're up against. But this was a regional project. This was how it was done regionally. And so being part of a team means you do it the team way too, and this was the team way.
But I will say most of the data that you will receive when the full report is presented is secondary data, is not just reflective of the survey population. Just because we would never get this amount of information, you know, if we had to go to folks. Nobody wants to talk about themselves in that capacity. And of course, if we're having problems, we really don't want to talk about it and open up. So we just do the best we can.
I had a question.
Yeah.
I think it's the next slide.
Yeah, we're under reasons for not receiving mental health care. The second response was other. That's almost 27%.
Right.
So I don't know if you had to further drill down on what
I
the other comments were.
not. Last cycle, when we did it ourselves without the region approach, we kind of had a open text box. But this time around, there was the other, and we didn't get any data with that, unfortunately, which it leaves a lot open to interpretation. Is it somebody that just doesn't know what to check, or are there actual barriers there?
But to your point, Dr. King, as part of the hot wash, Shannon, potentially you could say, well, 27% check other. We need to figure out a way to drill down into that other, whether it be a text box or try to amongst yourselves figure out potentially what those others could be to add another cookie.
Like those challenges. Thanks for that presentation.
And there's so much more. It was really hard to try and condense everything into something small.
And that comes with a lot of time and an excellent staff, which means also money. So now we have an update on budget from Sterling.
I just really hate that I missed the actual presentation of the budget that I know Lillian did so eloquently on my behalf. But I was still at home with my sweet little baby. So excited to be back. And I think you said just getting my feet under me. So today is more of a status update just to clue the board in that the first step is that we prepare the budget, present it to you all, get your approval, hopefully, which you did. The second step is we submit it to county management, who looks through it, asks questions, asks for data to support our request, and then it moves on to their analysis part. So they are digging deep, doing their own magic math that we like to use here. And then it is presented and approved by the Board of Commissioners. So we kind of joke that July 1 is like Christmas morning, where we log into our budgeting system and it's like, surprise, here's what you got for the year. So I just wanted to update the board that county management is currently doing their process, working through salary fringe, making recommendations that will go as a final prepared budget to the Board of Commissioners for approval.
Would you mind cluing them in on the questions that the county management asked us about the budget?
When we met with the county manager and the budget analysis management person, that might not be his official title, they did ask questions regarding our school nurse ratio, since we did get approval to add a school nurse to the budget for next year. They did also ask for data on our WIC participation, since we've requested an additional position there as well.
So we're hopeful.
Any questions?
Any questions for you?
And I'll be happy to share baby pictures if anybody.
Any baby questions?
Yeah.
Thanks, Karen. Welcome back.
Thank you.
All right, and now for the State of the Union. The year-end review for the health department.
Well, thank you so much. This would have been done in February, but y'all may remember February we had a lot of white stuff on the ground, and so we didn't meet. So this seems a little late to be talking about 2025, but when you got a lot to share, you just want to share. So I wanted to tell y'all what we were able to do in 260 work days. First, before we get too far into it, y'all may remember we were part of a video and photo library project. And so these professional photos that you will see throughout this presentation are the fruits of that labor. Jana, great job with your team. We have a ton now of professional photos of our team actually working. Shout out to the barbecue center. These are the restaurant photos. It was close by. They let us come in. I reached out to Cecil and he said, yeah, sure, y'all can come on up because they were coming in the morning. I would have bugged our friend Crystal over here, but y'all weren't operating on the day that they were there in the morning. So your kitchen missed out. But as two closed restaurants, we had great options and barbecue center that wasn't open for breakfast, but was in their prepared table. We were able to do that. So Stacy doesn't look worse for the wear, but that team was busy. They did a lot of work. They did 1,700 inspections last year. They issued 378 new permits, and they investigated 118 complaints. Some of those complaints are real easy. Some of them are not. So that 118 number can be misleading because some of them take a quick phone call. Some of them take a whole lot of work. So very busy with our environmental health, food, lodging, and institutions. And rabies is always busy with rabies too. 173,000 people live here. A lot of them get bitten. 475 bite reports that we investigated, and we know that that's not all the bites and scratches that occurred in the county, but we're trying very hard to do more education on folks to remind them, if you get bitten, please make a report so that we can make sure that we're following the right steps for the rabies prevention. Robin Lindsay and Allison Little are the two CRBs that we have, and they did 556 vaccines in the community. Those folks are part of the North Carolina general statutes that allow for non-professional veterinarians like Dr. Hamrick, or anybody that works directly with a professional veterinarian like Dr. Hamrick can give rabies vaccines just by the veterinarian rules, laws, regulations. CRVs are none of that. These two ladies that do this are volunteers. Robin is actually a PA in train or by her profession, and so she's very familiar with giving shots, but now she does rabies vaccines, and Allison goes along with her, and they go to folks that would probably never take their pets to a veterinarian, and they are providing rabies vaccines at the same cost that we're providing them here. So they don't make any money on it. They're just really providing them in the community. Animal shelter was very busy. We were able to provide during the year free rabies vaccines. So I don't know if the number the next year will be quite that high, but 2,500 vaccines for rabies was quite busy for the animal shelter. As it stands right now, they are charging $5 a vaccine because we did exhaust the funding, and that funding source had dried up for us to be able to do it for free. And then the smallest number on there is the rabies clinic that we did with the Davidson County Health Department. So Randy and Trey and I, and really the whole management team and our EPI team, will be working on figuring out the best way to bring rabies vaccines to the community, because the smallest number was maybe the heaviest lift of staff time. And so we're going to try to be a little bit more efficient with our delivery of that. And we've talked about this before. Oh, and that was Trey Bodo. He's the guy that's the rabies program specialist in environmental health. And the previous photo was Malcolm. So that's it. Now this is pregnant Corinne. That is not the real baby. That is the doll. And pregnant Melissa, who also had a baby recently, with our WIC director, Michelle. And in WIC, we saw almost 50,000 unduplicated participants. The $3,794,000 are WIC dollars that were spent in Davidson County during this time. So that is great. Those dollars stay in Davidson County. They go in local food stores that participate in WIC, and those dollars are redeemed here. And then our baby cafe, we're so excited about our baby cafe recognition that we've gotten for that. Corinne participated in baby cafe. So, it's not something that we just talk about, it's something we are about. We've had staff members participate in it too. We've heard great things from participants who, when the first time they had their first child, baby cafe wasn't in place, and they just had such a better experience this time. And that means we're spending less of our taxpayer dollars on formula because they are feeding their babies themselves. And so this is just a wonderful program, and we're thrilled to be able to have that and the success that we're seeing with that program. This is Tanya Hennessy. She's our CD supervisor, communicable disease. We remain busy, almost 1,800 reportable diseases in Davidson County. In 2025, STDs were the largest part of that, or STIs with over 1,000, and then the non-STI numbers there. But the largest disease by type was hepatitis C, which was 362. Here's our community health team. That's Tina and Sherlyn. They, on the care management team, made almost 2,000 client encounters, but there was some duplication. You have to visit more people more than once at times, and that is for the at-risk children. And then the care management for pregnant women, over 3,000 client encounters, and there were duplications in that. And then our community care management team served 63 clients, and that was unduplicated numbers. So very, very, very busy. And the work that this team does really does save money on the back end, because the work they do keeps people out of the emergency room and out of the hospitals with the preventive type care management program that we run. This is Leslie Diaz. She's talking about health promotions. And we did approximately 75 public health presentations that number is approximate because about everything we do is a public health education presentation. I could argue that when we meet with clients, we're doing that, when I'm going out and talking, but 75 is the number that got turned into Janice. So that's what we're putting in there. We did approximately 20 community outreach events. We're really trying to hammer hard on those job and career fairs to let folks who are in Davidson County concerned about what they're going to do in the future, that we have jobs here at the health department, and try to get them, turned on to one sooner rather than later. We did 20 call to acts. Those are just like cute little, you've done something great, and it's a coworker driven thing. Excuse me, y'all. Where if you see somebody doing something great, you turn it into Janice's team and just say, I'd like this person to be acknowledged for the work that they've done. So we gave 20 call to acts last year, which is just a nice way for people to know that somebody saw them. It's anonymous. I got one and I tried to strong arm it out of Tiffany, and she wouldn't even tell me who it was that did it. So I did ask her to pass along my appreciation, but she's like Fort Knox with information. Couldn't get it out of her. But it is a nice thing when somebody says, hey, you've done a great job. So we're going to talk a little bit more with staff as we go on to this year to remind folks that that is something that we do. And it does feel good when somebody says, hey, you did a great job. Brandon, who y'all see a lot at our meetings, he did about 300 IT work orders. Some of those are really complicated, and some of them are Lillian that's like, Brandon, my computer won't work. And then he comes and fixes it. And I was like, I promise it wasn't working before you walked into my office. But as soon as he walks in, like it magically clicks and works. But we keep him busy around here with almost 90 employees.
With my iPad, that would probably help.
Really good. And Brandon does a great job keeping us right. In our clinic, this is Rosa. She's in our vaccine room there, and we had over 6,000 non-duplicated patients, and we did over 3,000 immunizations. So that's really busy. Just a reminder, we do like back to school immunizations, or if you're one of those really cool people that gets to go somewhere that has vaccine requirements like Africa or something like that, we'll do that for you here for travel vaccines too. So we were really busy with that. This is Trey and Megan out in the field doing the drone work. And so, oh gosh, let me move this little thing so y'all can see these numbers. These are the numbers Randy provided. We're busy. Y'all know this in environmental health on site. We did a lot of repairs. I think I said 260 working days. So we had more than one repair a day. And that's a lot. Also more than one IPCA a day. And when you add this up and you think there's only 260 working days, these numbers, which might not look super impressive when you're looking at them like this, and then think, oh, we only had 260 days. It's a lot of work to be done for staff. And most of these events are not just a go out to the field and come back to the office and write. You have to do a lot of work. So quite busy in that program. This is Tammy Carrick. She does our vital records. Y'all might recognize her because she's at the front desk when you walk in. But you might not know that part of her job is she processes all the death certificates and birth certificates and home birth certificates. And those home births can take a long time and they're very complicated. So Tammy stays quite busy. When she's working on those types of things, we do provide coverage. Usually Crystal and her team will step in and they'll cover the front desk so that Tammy can do that work. But it turns out it's no longer a full-time job. When I first became the health director, Vital Records was a full-time standalone position, but over time with the increased use of online and things like that, it was able to be combined. So that's why Tammy has two jobs. And then here's just some photos of us that they took that I thought were really good. So these photos are all available for us to use on anything that we would need them for. This is Stephanie and Ashley. They work up here in the front, greeting our clients in the clinic. And then here's Leslie and Tiffany and Sherlyn. And this young lady actually came with the project. She's not a Davidson County employee, but she got stuck in there to be sort of like the Photoshopped person in there. This is Michelle and Corinne when Corinne is pregnant, looking at the baby in the breastfeeding room. Here's Randy getting a water sample out at the, where were you there?
Got to fall in.
That's at the wakeboard park.
They went out there, got the photos. Here's Jana telling everybody what's going on, and then Tiffany. Tiffany's our preparedness coordinator and our does accreditation with Jana. So I'm not that hard. And Michelle and Megan. I mean, these photos are just great. I don't know how the staff members that got them feel about them, but I mean, I want frame this if it were me, so they're just
I
really
saw them, several of them recently on LinkedIn on public like flyers for gosh, I can't even remember trainings, but anyways.
Oh, so they're using them at this.
Oh, yeah. I was like, wait, what are you doing there?
Here's Malcolm checking a barbecue shoulder, and he and Caitlin looking at the pH of a dish machine there probably.
Yeah, they have both right there. They have this machine.
Well, that's a quad. And then this is Leslie performing a fit test, which we do every year. It's not everybody who works here's favorite thing to do, but we do require that you get fit tested every year in case there is some sort of public health emergency that we have to respond to, and you wear an N95 for each individually tested every year, which is necessary because some of us gain weight, some of us lose weight, and these masks have to fit. We do it every year to make sure that we have the right mask. And that's Megan working on some permits there at her desk. And that was that. So thank you for joining me in the tour of 2025.
Sir. Any questions for Lillian?
I don't have anything for Lillian, but I do have something for you, Randy. Ran across a situation this morning where a lady bought a house, a 6-bedroom house. The permit was only for a 4-bedroom house. For the septic system. How does that happen? I know you're not in central permitting, but how could we do something to stop that from happening?
What people apply to us for is what we typically give them.
Right.
We don't go out and walk in homes and walk through them. Typically, the inspections department should catch that because what they submit to them typically are plans that shows bedrooms. Now, there's places on High Rock Lake and other places around the county, not to focus in there, but there's 2-bedroom septic systems and that's all that would fit.
Right.
And then they build a home with more than that. Maybe their plans call it an office, a studio, a den, a library, a playroom. But it has all the components to become a bedroom. And then when maybe a realtor or a for sale by owner or someone maybe doesn't go through the process of hiring a point of sale inspector to pull these permits and to do those records or due diligence isn't done, someone could purchase what they think is a 6-bedroom home, and on paper, septic is 4 bedrooms. So I think just due diligence, people should go through that because people do additions without permits. Not everything is permitted, believe it or not. Even the septic work, they don't always come to us. And so what might be in the ground might not match even what we have. So that's the $1 million question, how to prevent that from happening, because that's what we do every day is we try to get people what they want. It always doesn't work. And then they find a way to circumvent that potentially. And then if they pass that along to the next person, then they're kind of stuck holding that bag. I don't know if that answered your question at all.
I just didn't know. This house was plainly a 6-bedroom house. Paying taxes on it for a 6-bedroom house. But the permit was for a 4-bedroom. I was like, how did that slide through? Obviously, you do your work up front. You don't know what kind of house they're gonna build.
Yeah.
But I didn't know if you had any ideas on how to stop that happening.
I mean, usually it stops itself, I guess. Yeah, because when they go to sell that home, they've got a real problem on their hand.
Yeah.
The tax department, as far as I know, they're going to tax you for what either the appraisal is done for, or if plans were submitted showing that, even though it was not done compliance, they're going to send you a tax bill for it.
Yeah.
Now they could probably have that fixed and corrected because it, truly would represent a 2-bedroom home or 3-bedroom home or whatever the septic size for typically is what in the real estate world, the home is eligible to be advertised as.
How old was the field?
It wasn't that old. Maybe, can't remember. 10 years maybe.
My experience is if you write the tax department, you tell them this is supposed to be a 5-bedroom house and it only says it's 4, they'll gladly bump it to 5 and then send you a new tax bill. Yeah. Right. So I don't know if that's what's going on, but I do, I don't pull building permits, but I have been told that, in the past you would like not include closet. And then it was not a bedroom, even though there were people living in it, right? And now I think it can have a closet, and as long as you label it office or whatever on the plans, it is not a bedroom now. And so, that ultimately long-term may present some issue, just from a water issue. Now, I won't get too technical in it, but we know that on average, a 4-bedroom home is sized for 480 gallons a day. And in practice, they on average only use about 360. And so there's a little bit of cushion built in there, but 6 beds is a lot of people. You don't see that often, but there's a lot that could be going on that drives that. Ultimately, like, I don't know what you do if the septic system is sized for one thing and tax card system something else. Like, if you just disclose it and move on.
We have a lot of people try to fix that problem, when it comes to light, my builder built this home. He saved $1,000 by putting in a less of a septic system, so he could save that money for something else. I see that kind of thing, but then again, when someone's trying to buy it and they get that point of sale inspection and it's pointed out to the buyer, then they're coming to us asking for an expansion of the septic system, and we're tasked with seeing if that's possible, or dream crushing sometimes that it won't work.
Randy, may I ask another question to tap on to what Jason asked? And I apologize because this is not your rules, but environmental health doesn't allow for you, after you to issue a permit, to revoke it based on someone non-compliantly putting in a 6-bedroom home if you issued a 4-bedroom. In my training from 20 years ago, I will say no one in Raleigh or no one in Davidson County said, hey, Lillian, make sure before you do the final inspection, you walk through the house and make sure that there's only the number of bedrooms that you wrote on the permit.
Potential to issue an intent to revoke an operating permit is similar to probably a building inspector putting a meter on the home. The potential may be there. Obviously, I'm going to consult with legal counsel before we do something like that. But I don't know that we've ever done that in the past.
Maybe hand them one of those surveys too. I mean, yeah, that when you do apply for a permit, it does say something like you authorize, I think, the health department to go in your house and count bedrooms after the fact. Right? It says something like that on the permit application itself.
And I know other counties, I've worked in other counties, and some other counties I've just talked with people. They actually, when you get your construction authorization, they require you to submit a set of your building plans as part of your application packet. 90% of the people that come to us, they don't even know what kind of house they're building. They just want to know, can I get a permit to build this house? And, we're trying to fit their home inside of this box on the property, and then they're going to get plans after they figure out it works. So if we were to do that and implement that procedure, it's going to delay potentially people getting their permits. It would potentially cause excess cost on someone if they're not 100% sure what they want to build until they come to us and they can figure out what they want to build. So we've chosen not to do that here.
Well, thank you for everybody's attendance. I'd like to say I think this was a record, not because of the time, but we've been 1 hour and 9 minutes with 2 lawyers in the room and not a single word. I have to say something. Thank y'all for being. Also, thank you for Elizabeth coming and seeing it. We appreciate you coming, and hopefully you can come to the board. But at our next meeting, I believe, is June 2nd.
Yes, I usually put that on there.
I know.
Vacation mode. I apologize. Didn't put that on there, but yes.
June 2nd at 3 o'clock.
Yes. Thank you. Linda will send it out. She promises. Okay.
But with no other discussions, I will entertain a motion for adjournment. Second. All right, all in favor? Aye. All opposed? All right. Have a good afternoon, y'all.
Thank you so much.